afternoon, and thank you for joining us for today's briefing on COVID-19. This briefing is being aired on YouTube. And joining us today are DHS Secretary Designee Karen Timberlake, Dr. Ryan Westergaard, the Chief Medical Officer in the DHS Bureau of Communicable Diseases and State Epidemiologist for Communicable Diseases, and also Dr. Jasmine Zapata, Chief Medical Officer in the DHS Bureau of Community Health Promotion and State Epidemiologist for Chronic Diseases and Maternal and Child Health. And we'll begin today's briefing with remarks from Secretary Designee Karen Timberlake.
Good afternoon, and thank you all for joining us today. We continue to see a high number of reported positive COVID-19 cases. The majority of these cases are a result of the Omicron variant spreading rapidly across our state. Here are today's latest COVID-19 data and trends. As of today, 63% of Wisconsinites have at least one dose of the COVID-19 vaccine, and 58.9% have completed their vaccine series. Additionally, Wisconsin vaccinators have administered nearly 1.8 million booster and additional doses of the COVID-19 vaccine. Today, we are reporting more than 15,000 new confirmed cases, bringing our 7-day average of new confirmed cases to 18,836. Like other states, Wisconsin has seen an increase in the number of pediatric hospitalizations associated with COVID-19 as a result of high case activity. Since the start of the pandemic, more than 2,350 Wisconsinites under the age of 20 have been hospitalized with COVID-19. This includes 65 who have required some intensive care. Unfortunately, we are seeing a higher number of COVID-19 related deaths. We are sad to report that our total confirmed deaths have now reached 10,689. It continues to be disheartening to see these figures rise. Our thoughts go out to the families and friends who have lost someone to this disease. Our healthcare systems are still under tremendous pressure due to an increase in cases and staffing shortages. Statewide, 95% of intensive care beds and 95% of intermediate care beds are currently in use. As of January 19th, 2,163 Wisconsinites were hospitalized with COVID-19, and 459 of these patients are in the intensive care unit. As the Omicron variant continues to spread, testing remains a critical tool in our fight against this disease. We encourage you to seek out COVID testing from a trusted source. Visit the DHS website to find a community testing site, contact your local healthcare provider, visit your local pharmacy, your child's school if they are enrolled in our K-12 testing program, or order an at-home collection kit through the DHS website. In addition to testing, wearing a mask continues to play an important role in preventing the spread of COVID-19. The Centers for Disease Control and Prevention has issued updated mask guidance to help you find a mask that best fits your needs. All masks provide some level of protection against the virus that causes COVID-19, but some masks offer higher levels of protection than others. It is recommended that you wear the most protective mask you can that fits you well and that you can wear comfortably for long periods of time. You will get the most effective protection at reducing the spread of disease from a respirator mask, like an N95 or a KN95, if they are worn properly. Other types of masks can still prevent COVID-19 infection, but are not as effective as respirators. A well-fitted disposable surgical mask offers more protection than cloth or other woven masks. And again, it is important to remember that any mask is better than no mask when protecting yourself from COVID-19. Getting vaccinated and getting a booster dose when you're eligible offers the best protection against severe illness from COVID-19. It not only protects you, but supports the health and safety of the communities you live in. Today, we announced the Keeping Kids Safe and in School campaign to help encourage pediatric COVID-19 vaccinations and safety measures we should follow to keep our children and their teachers healthy and in the classroom. I will turn things over now to Dr. Jasmine Zapata to talk about the importance of getting your child the COVID-19 vaccine to help them stay safe and in school.
Thank you so much. As a parent, there is lots of information that has been going around about COVID-19 risk for our kids. And that's why I'm just so happy to be here today participating to talk about this very important issue. In addition to me personally being a mother of 3 beautiful children, I'm also a mother, I'm also a pediatrician and am the chief medical officer here at Wisconsin Department of Health Services for community health. And I am so passionate about spreading this information on the importance of how we can keep our kids safe, healthy, and in school. I want to speak from my heart today about some measures that we can do to keep our kids safe and healthy, and also about the importance of vaccinations. COVID-19 safety is not just about individual health for our children, but the health of our entire state. And there's a growing body of research that is showing that COVID-19 can have serious long-term effects on our children. Serious long-term effects on our children. In addition to the acute illness that COVID-19 can cause, there are also long COVID symptoms that our children can experience. And also there was a recent MMWR report that showed that there is an increased incidence of children being diagnosed with diabetes after having a COVID-19 infection. So from a chronic disease prevention standpoint, it's very, very important that we keep our kids safe and healthy. The bottom line is that risking our children getting COVID-19, it is not worth the risk. And that's why I continue to tell all of the families that I work with, whether it's in the hospital, whether it's in my community, whether it's in my personal network, that the COVID-19 vaccine for children ages 5 and up is the most effective way to keep kids healthy, safe, and in school. Since the end of August 2021, children in Wisconsin have made up more than 1 in 5 new confirmed cases of COVID-19. And as Omicron variant is spreading through our communities, it's important now more than ever to protect our children's health. So as Secretary Timberlake mentioned, getting your child vaccinated against COVID-19 and getting them boosted if they're eligible, not only protects them from the short-term impacts of COVID-19, but also from some of the long-term symptoms as well. It not only protects them, but also protects their teachers who they are around, their family members in the home, and the larger community. So that is why we are urging parents, anyone who is listening to this, we are urging parents and guardians to get your children vaccinated as soon as possible. How can you do this? You can schedule a vaccination for your child using a variety of options. You can go to your personal healthcare provider. You can go to community-based vaccination sites. I know personally, that's what my family did personally. You can go to local or tribal public health departments, or you could go to local pharmacies. If you want to locate a provider administering the Pfizer COVID-19 for children, and remember, children ages 5 and up can be eligible, you can go to vaccines.gov, or you can call 211 if you're not able to access the internet. When you're scheduling a COVID-19 vaccine appointment, it is also a great opportunity to make sure your child has gotten their flu shot for the year as well. The flu vaccine is another really important layer of protection to keep your kids healthy and to be able to stay in school and in the classroom. There are many studies that have been showing that COVID-19 transmission rates within school settings are typically lower or similar to community transmission when there are multiple prevention strategies in place. So we talked about the importance of getting your child vaccinated, but in addition to that, there are some other things that we want to make sure that we're emphasizing that you do as well to keep your children healthy and safe. In addition to the vaccine, make sure that they're wearing a well-fitted mask. And also, there's a lot of great work going on in our state about helping children be able to get tested while they are at school. There are many schools that are participating in our school testing program. So we're asking parents and caregivers and guardians to have a conversation with your children and let them know that it is okay if they are asked to be tested at school. Also, if you receive any permission slips or get more information about the process from your school about authorizing your child to be tested on site, we're asking that you participate in that process. virus. Testing is really, really crucial in helping to slow the spread, particularly of this Omicron variant, which is spreading very, very rapidly. And we talk a lot about staying safe and in school. Why is school so important? There's many studies that show that school is a very, very important environment for children to continue to develop life skills that are going to be very important. It also helps them cope with some of the very things that they're facing now in this pandemic. The COVID vaccine can keep kids in the classroom, and it can help them build connections with their teachers and peers that are so crucial for their mental well-being. And again, getting kids vaccinated is one of the best ways to keep them safe and in school. And that's one of the best ways that we can overcome this pandemic together. And finally, I want to speak from my heart to talk about the mental health impacts that we're seeing on our children in this pandemic. We talk a lot about physical health for our children, and that is so important. But it is so important now more than ever to continue to have conversations with them about their mental and emotional well-being. We know that this pandemic is hard, and it continues to be hard on our kids. There was a recently released report from the Office of Children's Mental Health, and we are seeing that there's increased rates of suicidal thoughts for teen girls. There have been increased just in general in our state of opioid overdose deaths. There's been increases in household domestic violence. There's been increased anxiety and other stressors in the home. And we want to make sure that we do all that we can to continue having conversations about mental health with our children and doing all that we can to support them. So overall, the main message is that we know that this is a hard time, but stay resilient. The best way to keep your kids healthy and safe is to get the vaccine if they are eligible, and also continue to talk to them about their mental health. And I'll turn it over to our next presenter. Thank you so much.
Thank you. And we are now ready to take your questions. A reminder to maintain audio quality, please remain muted until it is time to ask your question. If you are able to do so, use *6 to mute and unmute your phone. And in the interest of time and to ensure everyone gets a chance to participate, we ask you to please limit yourself to one question. And we'll begin this afternoon with Alex Moe from wisbusiness.com. Alex?
Hi, thank you for taking my question. I'm wondering, does DHS have an estimate for when the current Omicron surge is expected to peak or begin to decline in Wisconsin based on modeling data or just what we're seeing in other parts of the world and country? Thank you.
Happy to pass that right to Dr. Westergaard.
Good afternoon. So the data that we have from Wisconsin does not indicate that we have reached the peak. I think that's what we can say most safely. Look at our 7-day average of confirmed cases. The average as of today is higher than it's ever been. And it increased very quickly to get to this point. I think the reason for optimism is that there are some jurisdictions that seem to have a decline in the past week. So I think we can be hopeful that we are near the peak, if not there already, but unfortunately not seeing that with our data. The key unanswered question that I think we're all looking for is the decline going to happen quickly, or is it going to be a prolonged decline? Our hope is that we can turn the corner and see fewer and fewer cases as the weeks go on. But I think the important message is that we can get that decline to happen quicker if we implement all of the prevention strategies and wear masks and do the things that we're talking about and to try to stop transmission as much as we can. So thanks for the question.
Thank you. Now to Sophie Carson from the Milwaukee Journal Sentinel. Sophie?
Hello, this question is also for Dr. Westergaard. With the case numbers, the current case numbers affected by the system change, is wastewater giving us the best idea of current COVID trends, and what is it telling you?
Yeah, thank you. It's also a good question. As you alluded to, our process for getting test results from people that are done in community test sites or clinics, has to get reported through computer data systems, and day-to-day changes might fluctuate depending on delays in that reporting. So that is why, as I just mentioned, it's more informative to look at the 7-day average of cases, which tells us sort of what we've been seeing in cases being diagnosed in the community that's smoothed over, doesn't have some of that day-to-day fluctuation. And the take home from that is that, yes, it's been steeply increasing for the past several weeks. And as, like I said, today that is higher than it has been ever during the pandemic. The question of wastewater treatment is been an interesting and frankly surprising success, because we haven't used that type of technology for awareness of respiratory virus infections ever. So it has been in a lot of different jurisdictions. In Wisconsin, as you can see on our DHS website, we've accumulated the data from a large number of wastewater treatment facilities where we test and measure the quantity, how much of the virus genetic material is detectable. And because those capture a large catchment area, it's actually tracked relatively well. It's gone up at the same time that cases have gone up. And the lessons we've learned across the country is that it's sort of followed the same peaks and valleys of transmission. So I wouldn't say that it gives us better information than cases, but it's another dimension, another perspective that we can use to show, and potentially as an early warning sign where cases are increasing. So those data haven't told us that we've reached the peak either, but it's something that is worth looking at as another perspective to see where we are in the epidemic, and we use it for that reason.
Thank you. Now to Drew Sutherland from WSAW-TV in Wausau. Drew? WSAW?
Hi, sorry about that. I pushed the wrong button. We actually had planned on the same question as Sophie, but I do have a chance to take a different tack here. Since you're announcing the Keeping Kids Safe and in School campaign, I'm wondering, are you formally suggesting that schools should enact mask mandates, since that is an enclosed space that kids are going to be in?
So earlier in the year, actually late last year, we did promote obviously safe practices in light of the rapid spread of the Omicron variant. So on December 20th, the department did put out a public health advisory encouraging everyone to get vaccinated, to wear a mask in public indoor settings. And then just earlier in January, we issued a letter to all school administrators encouraging them to adopt the safest practices that we know work to help keep kids safe and in school. So that's making sure that schools sign up to participate in our K-12 school-based testing program. We've got, as of today, about 80% of the public K-12 districts who participate in that program. We've got 23% of our private schools. In addition, we encourage schools to offer on-site vaccination and booster clinics, especially during drop-off and pickup times, to make it that much more convenient for kids and for parents as well, and guardians to get vaccinated. And we encourage schools to be requiring masks for everyone, parents who visit and other visitors, kids obviously who are in school, teachers and staff. We know that masks are so important as a part of a layered protection strategy to making sure we can all achieve what we all want, which is to have our kids be safe and in school.
Thank you. Now to Scott Bauer from the Associated Press. Scott?
Hi, thanks. I'm going to pass for now. Thanks, guys.
Okay, thank you, Scott. Now to Sean Kirkby from Wisconsin Health News. Sean.
Hi, thanks for holding this. Just was wondering, can you talk a little bit about the impact of the National Guard deployment and nursing homes? Have you seen any strain come off of hospitals with the deployment of those, I think, 80 soldiers last week? Thank you.
Yep, you bet. So we actually have about 50 National Guard members who were deployed right away last week into 6 skilled nursing facilities around the state. That did free up several dozen long-term care beds that are being used today, and we are hearing good feedback from our hospital partners that they are seeing the opportunity to make some patient transfers. We do have another group of 80 National Guard volunteers who are in training as we all sit here at Madison College, getting trained up in the 75-hour CNA training course. They will be deployed by the end of January, and we expect that that will free up in the neighborhood of another 175 or potentially as many as 200 additional beds. So we're very pleased with the progress, so appreciative of our National Guard volunteers, so appreciative of Madison College and of our skilled nursing partners who are really working hard with us to make sure that as we get those Guard members trained up and available, we can put them in places all around the state so that hospitals all around the state have access to additional long-term care capacity. So early days still, but very pleased with the progress and looking forward to continuing this very successful strategy.
Thank you. Now to Rhonda Fox from WKOW-TV in Madison. Rhonda?
Hi, so today the Wisconsin Department of Trade and Consumer Protection said that you all, the DHS, could answer this question, and it's one, can an individual in Wisconsin resell their COVID-19 test that they will receive from the federal government website? And if not, if you could talk about the ramifications. Thank you.
Appreciate the question. It's not something that I'm aware that we've looked at in depth, so we'll be happy to consult with our Office of Inspector General and our Office of Legal Counsel, as well as our partners at the Department of Agriculture, Trade and Consumer Protection. I think the important thing for people to know is that it's really important to find reliable sources for COVID testing. Those are available, as Dr. Zapata noted. If you go to the DHS webpage, we've got a great link, great interactive map of all manner of community testing sites. We now have a total of 508 community testing sites located all around the state of Wisconsin. In addition, you can go to the Department of Health Services website and order a free at-home PCR test, a vault test that you collect at home with an online proctor. You send it in, you get the result. And of course, there are the free tests that are available to every household in the country now through the Biden administration strategy. So my suggestion would be, if you're looking for a COVID test, I would look first to any one of those resources before you look to anything that might appear to be a resale market, but certainly appreciate the question and we will look into that.
Thank you. Now to Mark Krieger from Fox 6 in Milwaukee. Mark?
This is Gabrielle in for Mark. Our question was already asked. Thank you.
Thank you. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Yeah, thanks for holding. My question is for Dr. Westergaard, and it's kind of related to the first question that was asked here. What do you think the trajectory of the pandemic is going to be after the Omicron variant starts to wind down? We had yesterday, the CDC said that natural immunity from infection, when it came to Delta, actually provided slightly more protection than people who were just vaccinated. And so with so much, natural infection going around and so much natural immunity after the Omicron variant winds down, going to see a chance for this pandemic to fade. Thank you very much.
Yeah, thanks, Rob. I think of that question, that question often, and of course, don't know the answer, but can highlight some of the considerations that go into what might determine what it looks like in the future. And one is the encouraging news that there is protection from that it lasts a significant amount of time from vaccination and from natural infection. And on the other side of this current surge, where people are becoming infected in greater numbers than ever, I think you're right. We're gonna have a lot of people that have some level of immune system protection. That's generally how pandemics end. When we look at influenza, over time, the population gets immunity, but it's imperfect. So the thing that's really the question mark is going to be whether and when additional genetic variants that can escape the immunity that we have accumulated over the past 2 years. I think that in that sense, the Omicron was really a surprise about how severe and quickly that took off. I think we were all expecting that we were going to have a hard, long winter with a lot of cases driven by Delta and potentially influenza. And the fact that now we've seen very little of those, almost no Delta and all Omicron, really, I would say was not possible to predict ahead of time. So if things continue on their current trajectory and we see Omicron wane because it essentially runs out of people to infect, if the weather gets improved, we could be in a good position, similar to what we were hoping would continue last summer when cases were at low levels of transmission. But I think we have to use all the tools we can to minimize the possibility that we'll have new genetic variants come up. I think that's where we need to talk about global vaccine equity. We need to continue to press for vaccination to minimize transmission, because minimizing transmission lowers the risk that new genetic variants will emerge. So that's really what the future depends on. In what it will look like is, some of it is just going to be luck in terms of the evolution of the virus, and some of it's going to be how hard we work on getting the remaining unvaccinated people vaccinated around the world.
Thank you. Now to Kaylin Schumacher from WBAY-TV in Green Bay. Kaylin?
Hi, guys. Hi, guys. Thanks so much for holding this today. We know that the president said that he was distributing masks. That kicked off this week. And I know that Evers has doled out a few in our community. I was just wondering if we've made any connection with the president to get more of those N95 masks here in Wisconsin and available to the public.
Yep, thanks for the question. So the mask supplies that we do have are being distributed to our local and tribal health departments, to our local emergency management partners, to healthcare providers, and to schools. We know that those are settings where we need to make sure that we've got high quality masks that are available widely in the community. We do ask our local partners to see what they can do to source masks locally, because while it is the case that unlike very early in the pandemic, the supply of masks has certainly improved. We all remember what those shortages were like a couple of years ago. Nevertheless, state supplies are somewhat limited, and so we want to make sure that we are prioritizing distribution of those masks to organizations and to settings where there may be difficulty sourcing those masks otherwise. The efforts that the President's administration is making to make N95 masks available to everyone, similar to the efforts to make some at-home testing available to everyone, are a great complement to that strategy. We certainly encourage everyone to take advantage of that opportunity. And as I noted in my earlier comments, it's really important that everyone wear the highest quality mask that they can, that is comfortable for them, that fits them well, anytime they are in a public setting. The mask will protect others around you if you might happen to be infectious, and they will also help to protect you from breathing in any of those droplets that might carry the Omicron variant. So really important, given the highly contagious nature of Omicron, for us all to be doubling down on our mask wearing.
Thank you. Our next question goes to Kaya Murray from Fox 11 in Green Bay. Kaya? Fox 11? And a reminder, *6 unmutes your phone. Once more for Kaya Murray at Fox 11. Okay, moving on then to Susan Bentz from Milwaukee Public Radio. Susan? Again, Susan Bentz from WUWM Milwaukee Public Radio. Susan, are you there? Okay, moving on then to Jack Kelly from the Cap Times in Madison. Jack?
Hi, all. Thanks for doing this call. My question is for Secretary Timberlake. I'm wondering, is DHS been receiving complaints about the private testing company, the Center for COVID Control? They run numerous testing sites throughout the state and here in Madison, and are being investigated by the Better Business Bureau of Wisconsin, the Oregon Department of Justice, and others for potentially administering fraudulent tests. So I'm curious, has DHS been hearing complaints about this company, and what is DHS doing to make sure Wisconsinites aren't seeking out potentially fraudulent tests?
Yep, really appreciate the question. So let's start with the second half of your question first. The very best thing people can do to make sure that they are dealing with a reputable testing vendor and getting a high quality COVID-19 test is to go through the Department of Health Services website to our testing webpage and to look for all of the many testing sites that are listed there. In addition, folks without easy web access or who need a little help navigating it can call 211. We've had just a tremendous partnership with the 211 network across our state. They can be very helpful in helping you identify a place to get a reliable test, as well as a place to get a vaccination while you're at it. Can't speak to specifics today of any particular complaints. What I can say is we are taking every complaint very seriously, working closely with our partners in the Office of Inspector General here at the Department of Health Services, our partners at the Wisconsin Department of Justice, to make sure that we don't allow any kind of fraudulent or otherwise poor quality testing sites to be operating in our state. People who do have concerns or complaints that they would like to let us know about can give us a call on a complaint hotline that has been established. And that number, which we will certainly send around again, is 877-865-3432. And we also have an online complaint portal as well for those who choose to use that route.
Thank you. Now to Victor Huckabo from CBS 58 in Milwaukee. Victor.
Hello again. Thank you for taking this call. This kind of bounces off a previous question about the distribution of masks from the stockpile to community partners and others. We've heard kind of mixed results from different health departments and other communities in our area about some getting them fulfilled, sometime this week or soon. Others are still waiting for more information. So I wonder if you could just kind of describe a little bit more of the process in terms of, like you said, prioritizing who gets their order fulfilled, what may be some slowing down of the process, and if there's any more description of the stockpile in general. Thank you very much.
Sure thing. So the way that we have handled this in the last couple of weeks is through a survey that has been sent out to emergency management partners and to local and tribal health departments, who again, just throughout the pandemic, have been that first line of defense for their local organizations, schools, and others, to make sure that folks can understand what supplies may be available and how to access them. We did invite those local partners to order what they thought they needed. You can imagine that some ordered sort of exactly what they thought they would need, others ordered more, and so we did have to make some adjustments in what some of the requests were as compared to what we could supply, so that we could be fair and distribute adequate supplies where we could to everyone. It's also the case that we have a larger stockpile still of N95 masks than we do of KN95 masks. And so we are working to replenish the KN95 supply. And we are also working to source additional youth and child size masks to make sure that we have those as well. So it's an ongoing process. And again, we encourage local partners to source the supplies that they believe they need from the locations that they can access them, and through your local emergency management and your local public health, that's the best way to filter further requests up to the state system.
Thank you. The next question belongs to David Wahlberg from the Wisconsin State Journal. David?
Yeah, thank you. Secretary Timberlake, at the beginning of the call, you talked about pediatric hospitalizations. I think you provided some statistics related to that. I was a little distracted, so I didn't hear if those numbers were specifically about pediatric hospitalizations, but could you just talk a little bit more about that situation? And if those were those statistics, what ages did they include? What have been the trends recently? And do you have any information about the kids in hospitals? Do they have chronic diseases? Were they vaccinated? That kind of thing.
Appreciate the question. I will share some answers, and then I'm going to pass this one over to Dr. Zapata, who I know will have other perspectives to share. So the data that we do have available on our website looks at hospitalization by broad age categories. And if you aggregate the youngest ages up to people under the age of 20, since the beginning of the pandemic, there have been 2,350 young people, some very, very young, and some teenagers under the age of 20 who have been hospitalized with COVID-19. What we know in general is that the analysis that we have been running on a monthly basis for a while now about people's risk of being hospitalized if they are not vaccinated as compared to if they are vaccinated against COVID-19 is we, as of our December data, are showing that those who are not vaccinated are 10 times more likely to be, or they are hospitalized, I should say, at a rate that is 10 times greater than people who have been vaccinated. That's all ages. It's not kids and young people specifically. But I'll turn it over to Dr. Zapata for other thoughts on what we're seeing in terms of pediatric and young adult hospitalizations.
Yes, thank you so much. I would echo what Secretary Timberlake mentioned. We're seeing that the majority of children who are hospitalized or in the ICU are unvaccinated. So again, just sharing the importance of vaccinations. And also, as far as some of the specific numbers, just a snapshot, one of the largest children's hospitals in Wisconsin, Children's of Wisconsin, their January 11th to 17th data from January 11th to 17th of 2022, there were 57% rooms occupied and about 54% of their ICU rooms occupied. And looking at their data, it's been decreasing just a little bit over the last few weeks, but these are still high numbers hospitalized with this is the COVID-19 data. So that is just a little bit of a snapshot. We're still seeing children being hospitalized for this. And again, the best way to prevent severe illness and death is getting vaccinated. And that's one of the best ways we can protect our children.
Thank you. Our next question belongs to Mary Jo Ola from TMJ4 in Milwaukee. Mary Jo?
Hi, good afternoon. My question is about mask mandates and the effectiveness. Milwaukee's acting mayor this morning signed a new mask ordinance that's supposed to take effect in the next couple of days. So my question is, given the positivity rate we're seeing, given that there isn't like a statewide mask mandate, what are your thoughts in Milwaukee implementing one and its effectiveness? Thank you.
Sure, you bet. What we know first and foremost is that masks work to protect all of us against COVID-19, and that is why they have to be a key part of this layered prevention strategy that we've all been describing. What we also know is that where we are required to take an action, we are more likely to do it. And so when you walk into a store that says masks are required or please wear a mask, we know that more people will be taking that step. And so we applaud the efforts of Milwaukee leaders to reinstate a mask requirement across the city. We think that's a really important step to helping to contain the spread. We also are seeing numbers of our school districts around the state, certainly consistent with the guidance that we put out earlier this year, and also consistent with what they are seeing locally. We're seeing numbers of school districts reinstate mask requirements for kids in school and for teachers and staff in school. Again, that's just a really important part to helping us all slow the spread of this very contagious Omicron variant and helping us all put the pandemic behind us, which we are all very eager to do.
Thank you. Now to Rashad Williams from WAOW TV in Wausau. Rashad? Rashad Williams from WAOW.
While we're waiting for him, is it okay if I add one thing about of the importance of masks, Jennifer?
Of course, go ahead.
Okay, all right, just echoing what Secretary Timberlake was saying, one thing that is so important to note about this new Omicron variant is just that it is able to spread so quickly and it can linger in the air. And so when we think about wearing masks, a lot of times we think about, okay, we're protecting ourselves from sneezing or coughing and it going to other places, but it's really important to note that you can walk in a space and the person that was there before you, if they're infectious with COVID, even if they're not physically there, it can linger in the air. So it's so important, especially now, to stop the spread to wear masks. And I agree with Secretary Timberlake in our applauding Milwaukee for that move.
Thank you. And once again, Rashad Williams from WAOW TV. Okay, we'll move on then to Savannah Tomei from Spectrum News. Savannah.
Good afternoon, everybody. Thanks for taking these calls. My question has to do with self-reporting at-home COVID tests here in Madison and in Dane County. There is a form where people are able to self-report, and then that gets put into the WED system manually. Obviously, it doesn't end up with duplicates because of the checks that they can do through that system, but are there any plans to expand that into other parts of the state or potentially even statewide? Thank you.
I'll just introduce this and then pass it over to Dr. Westergaard. We certainly know that at-home tests are becoming more widely available. We think that they are an important part of the overall screening that people can do for themselves, helping them answer a question kind of in the moment about whether a symptom may or may not be COVID. That said, they do have their limits, and we want to be thoughtful about how we are advising people to use those tests and rely upon them. So I'll pass that to Dr. Westergaard.
Sure. We're not anticipating that at a statewide level, we're going to require or strongly recommend people formally report their results. Home tests are really for personal decision-making. And if someone gets a reactive or a positive result, the recommendation would be to call their medical provider for advice about what to do. People should by now know that when someone tests positive, they should isolate at home, stay out of contact with others. But if they have questions about what this means for my health, do I need treatments, so on and so forth, that should trigger a call to their medical provider, who may do a confirmatory test or may give other advice. So I think as testing is evolving to rely on more at-home tests, and our response to the pandemic as it continues to evolve, we'll probably be in a place where getting every piece of data from every test that happens at home doesn't serve as useful a purpose as it may have a year ago. So I think for that reason, I think we're encouraging people to use those tests for the valuable information they can provide. But I think we'll be fine if we don't capture 100% of them in our surveillance system. That being said, the more we know, the more we know. So there's certainly nothing wrong with reporting those tests to public health, because we can put them in the proper context. So that's our strategy, is part of one part of many different sources of data that we use for surveillance.
Thank you. Now, there were a couple of reporters that we called on that weren't available the first time around, so we'll try again for, first off, Kaya Murray from Fox 11 in Green Bay. Kaya? Okay, moving on then to Susan Benz from Milwaukee Public Radio. Susan. And finally, Rashad Williams from WAOW TV. Rashad? Okay, with that, we'll conclude today's briefing. Our thanks to all of you for joining us today. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Be safe and have a great afternoon.